All right, let's go ahead and empty this. You ready, Gonzo?
Watch your face.
Yeah.
Wow. There we
Wow, I
go.
never seen something like that. Never.
Never? Well, you haven't been watching our videos. Shame on you.
Oh, I watched them, but I
What does it
didn't
get us?
I think Popeye might be pulling a little something over on us there, little
Wrong.
Gonzo. All right, so Popeye, we got the video rolling here. Let me ask you a question. You'll consent? Are you okay if we video you for all of our internet and YouTube fans?
Yeah, that's fine.
Fantastic, good deal. And we're going to work. You've got more than one cyst, but we're going to work on one here today, and we're going to put you on some antibiotics and do the other one in a week. We're going to get this one first. But let me ask you, this big fella back here, how long have you had him?
That one for about 14 years.
About 14 years. So you ran right in on it, huh?
Yes.
Oh, I'm just giving you a hard time. We got Gonzo on the cam, and you're going to give us some cold spray, right? Whoops. Don't.
You're putting your finger.
Yep. All right, get a close up. All right, you ready? We're going to give you a little anesthetic, a little stick, sting, and it burns. What Gonzo's going to say here in just a moment.
Right, there you go.
Ready? Say it.
Sing, stick, sting, and burn.
There we go. Medicine's going right in. Watch out, Gonzo. It looks like it wants to spray out right there. Oh, it got you.
But it sure
Did
did.
it get my camera?
Not really.
All right. A little more cold spray. We're going to go in a different direction here.
All right.
Not really. Does that mean yes, it did?
It did get me. It got me actually in the face.
It's your turn since it got me. What was it, yesterday? Or
Yeah. No,
No, it was
Monday.
Monday, yeah. It was your turn.
He's milking. I'm just kidding.
Is it hurting, my friend?
No, not really.
You doing okay? We're going to give you a lot of medicine here. We're going to get down in here and do a good job with our anesthesia today. You know, a lot of people don't want to see this part of the procedure, but I think it's an important part. I really do. Now we're going to go a little bit deeper.
All right.
So for those of you who are watching by video, we've got Popeye's darling wife is standing behind Gonzo with her arms crossed, making sure that everything goes well. We've got his darling daughter and grandson in the room with us. How old is our grandson?
Almost 2 months.
2 months?
Almost.
Really?
10 pounds already.
Really?
12.
All right, here we go, little Gonzo. You
I
ready?
used to do that. I used to just poke it in.
Yeah.
Squeeze it. ¿Te duele?
Does it hurt?
Yeah, very little bit.
Well, if it hurts, you say something. You're going to feel some pressure. I'm pushing on you, but you shouldn't feel a lot of pain.
Tienes que decir, no vaya a ser como vaya en el hospital que te
Gonzo, get it now.
cuartizaron.
Yeah, if it hurts, you tell me.
All right.
Porque te van a abrir todo el cuero.
Okay, Gonzo, get in here. We're going to open this up a little bit. It's like you had a caterpillar come out of there just then.
Oh, wow, vieras cómo le salió. Todo lo blanco que te salía antes.
Is that pretty amazing? Did you think Popeye would have a worm in there like that?
I knew it. I told you,
Yeah.
a long time ago, I used to poke it and
Yeah.
squeeze it.
Yeah, a
It
long.
was little, no?
Uh-huh. Well, guess what? It's all grown up now.
Yeah, yeah, through the years.
All right, let's go ahead and empty this. You ready, Gonzo?
Watch your face.
Yeah.
There we
Wow, I never seen something like that. Never.
Never? Well, you haven't been watching our videos. Shame on you.
Oh, I watched them, but
What
I
does it
didn't.
get us?
¿Quieres irte para afuera?
Are you hurting?
No, no.
All right, here's the cyst material right there. Did you see that?
Oh,
That's the cyst
like
wall.
the bag.
That's like the bag, exactly.
Oh, okay, okay, good. Just
We're going to get some more here right there. It's coming right out.
Wow.
There's some more.
Ya te sacaron toda la carnita. Thank you, guys.
There's some more.
Todavía tiene más adentro.
You guys are going to have to let me in on some of this
We're
discussion.
just saying that he still has more inside.
Oh, there's a lot more there. Yeah, it's coming out though. There's more coming
If you
right
want to
there.
go right outside, you can.
Are you feeling okay?
No, I was talking to her.
Oh, okay. To Popeye's daughter?
Yeah, Popeye's daughter.
We know Popeye's daughter, but we're not.
This is Olive.
Yep.
She's Olive.
Look at all this coming out of here. It's coming right out, Mama.
It looks like it is a fabric.
It kind of does, doesn't it? Yeah, it kind of does.
Like very thick.
It is. And this is why the other one that he has that we're going to work on next time,
Yeah,
they didn't work on getting
They
this.
didn't.
Now, are you hurting?
They just drained it.
Okay. Did you have pain?
They told us that they were just gonna drain.
Does it feel like a dull pain or a sharp pain?
Ooh, Gonzo's getting into that pain type thing.
I'm sorry?
Yeah.
Te duele
She's so
como
worried.
sharp o bien poquito?
Very little.
Okay. If it hurts, you're going to tell me, though. That's what matters.
You'll get more pain med if you need any.
I'm going to get a little more out here now.
They did it.
Yeah, they're not going to. In an emergency room where you go in with a big infection, they're not gonna dissect the cyst out. They really don't have time to do that. I'm not saying it's right. I'm just saying they typically aren't going to do that like we're doing here, but we'll get it out for you. Now we're going to start.
Thank you for calling me and letting me know about it. Popeye's daughter.
No problem.
We didn't know about you guys because you know what? We went like a year ago to the doctor, to the clinic over there.
Yeah.
And the doctor say it hurts. He didn't have the big one on top. He just had that one.
He just had this one right here.
Yeah. And because I've been worried about it, you know.
Yeah.
So hard and growing, and
Sure.
for so many years. And he asked him, it hurts, and my husband say no. So I say no, there is nothing to worry about. It is fine.
Well, it's not terribly dangerous. It's just uncomfortable, and it's not pretty. I'll tell you that. But the other thing is it's a site. It's a site where infection can get started. Look at all that. Yeah, just pretty surprising, isn't it?
Yeah.
Gonzo, I hope you're getting all this glorious cyst on tape here for us,
I'm double charging you because I got really bad.
because you got doused.
I got
Look at
doused
this.
today.
Now look at all of that. That is all. That's all cyst wall right there. That's coming out. Popeye, you're gonna love this video when you see it, if you want to.
Tengo bastante en el pelo.
Oh, we can send it to
Tengo
Tia.
bastante.
Gonzo, take a look in there.
No, just like
I want everybody to take a good look in there. This cyst has been removed. Take a look in there. I'm going to try to open this up a little bit more. You can see it. It is gone. I don't see any cyst material. So now what we're going to do is put some stitches in. But before I put some stitches in, we're going to rinse this. So let's take a time out and get some rinse, little Gonzo. We're back here with Popeye. We're going to do a little rinse. This is just some hydrogen peroxide that little Gonzo hooked us up with. But we're going to flush this out. I like using the hydrogen peroxide because it bubbles and it helps bring out all the debris. And just, you know, short-term use of some hydrogen peroxide is not dangerous to the skin. If you used a lot of hydrogen peroxide, I guess it could be a problem, but not for a small procedure like this. So it helps bring stuff up, make sure that we don't have anything stuck in there that we want to remove, make sure that all of the debris that's actually inside the cyst comes on out. Mr. Popeye, are you having any pain?
No, no, sir.
Okay.
Oh.
All right. There you go, little Gonzo. Nice and clean, pretty in the bottom there. Let's put a few stitches in. Here goes. We're going to put some stitches in for you.
All right.
This is a 3-O-proline, which is really good for the back. It's not really good for many other places on the body. At least not for our purposes here in the clinic. I suppose in the surgical suite there might be. Okay. You want me to cut, little Gonzo?
Sorry.
That's all right.
I don't have any gloves on now.
You're my camera person anyway.
How does the people accumulate the cyst?
Oh, some people just make them. That's a great question. Some people just get cysts. And I had a patient a number of years ago that was just absolutely had cysts literally all over his body. They were everywhere. Poor guy. And I thought for sure he had some strange genetic disorder or something weird was going on. And I sent him over to be evaluated by some other, limited specialty docs. And the answer was simply that, he just makes cysts.
Oh.
I'm like, okay, if that's all it is, that's all it is.
Look, my husband, he has two.
Yeah. So he's got, well, he's got more than two. He's got two large ones.
And yeah, it just get my attention. I had one when I was little.
Did you?
Yeah, and it was removed like this one.
Uh-huh.
You know, totally. Never came back. It's right here.
It never came back. Good.
Mm-hmm. But I
Look at
was
this. It looks like we're
little.
tying up football here, Gonzo.
Right?
Mhm.
Okay, so we are done for today.
All right, Popeye. Thank you very much. and
Great.
We'll see you in a week.
Great job, my friend. All right, so we'll take these stitches out in a week, and at that time we'll show everybody your other cyst that we're going to do for you. And you'll be on some antibiotics for it. You don't need antibiotics for the one we just did because it's not infected. But I do have pain pills and I do have nausea medicine for you, so you'll be good to go. Any questions?